Okay, video submission for week 9. We're gonna do the knee, ankle, and then hip. So we're gonna walk through the setup for knee MRI. Before we can go into the scanning room, we gotta demetalize, tap our cells, pockets. We gotta check for wallet, keys, cell phones, any electronics, jewelries, bobby pins, or any loose change. And then, so we go into the scan room. We gotta make sure we have to clean up. We gotta disinfect all surfaces. We gotta clean up and disinfect the MRI table, maybe doorknobs. We gotta clean up the coils and paddings. We gotta get we have to have fresh linens and pillowcases ready. And then we have to make sure we screen the patient appropriately, have them change from street clothes into hospital gowns, and then we're gonna give them headphones for hearing protection. Ready the coil that we'll be using. And then we gotta provide them the emergency squeeze ball for communication. Coil use and how is the patient positioned. So the coil we'll be using, we have several coils that we can choose from, but our best pick would be the HD knee coil or quad channel chimney coil. Positioning would be feet first, supine. Describe the angulation and coverage for axial, sagittal, and coronal sequence. So for the axial sequence, we're gonna plan the slices on the coronal plane. We're gonna angle parallel to the medial and lateral condyle of the femur. We gotta cover from the tibial tuberosity up to the line of the superior patella. And then we gotta make sure to include the tibiofibular joint. Oh, our landmark for the knee is the inferior patella. Now, for the coronal sequence, we gotta plan the slices on the axial plane. We're gonna angle parallel to the medial and lateral condyle of the femur. Coverage from the anterior patella to the line of the popliteal artery. And for the sagittal plane, we gotta plan the slices on the axial plane. We're gonna angle parallel to the lateral condyle of the femur and cover from medial to lateral condyle. And now we have the ankle MRI set up again. We gotta demetalize before we go into the scan room. Check for wallets, keys, cell phones, any electronic, jewelry, bobby pins, ID badges, or any loose change. Coil used. For the setup still, we gotta make sure we've disinfected everything. Clean up MRI table, disinfect all high-touch surfaces. Disinfect. We gotta get the linens and pillowcases, fresh linens and pillowcases ready. Disinfect pads and coils. And then we gotta provide the headphones or hearing protection. We gotta get our coil ready, and then we have to provide them the emergency squeeze ball for communication. Coil used, chimney coil. Positioning would be head for the ankle, feet first, supine. And then if possible, we gotta dorsiflex the ankle. Landmark would be the malleoli of the ankle. Angulation and coverage for an axial MRI of the ankle, we gotta plan the slices on the coronal plane, angle parallel to the mortise joint, and then coverage would be from just above the tibular joint down to the plantar aspect. Coronal sequence, we're gonna plan the slices on the axial plane, angle perpendicular to the medial and lateral malleoli, and then coverage, we gotta cover from the Achilles tendon to the midfoot. Sagittal sequence, we gotta plan the slices on the axial plane. We're gonna angle parallel to the medial and lateral malleoli, and then we're gonna cover from the Achilles tendon to the midfoot. Axial coronal. And for the sagittal sequence, we're gonna plan the slices on the axial plane as well. Angle parallel to the medial and lateral malleoli. Coverage from outer aspect of the lateral malleoli to the outer aspect of the medial. Outer aspect of the lateral to the outer aspect of the medial malleoli. Now we have the hip MRI. Walk through the setup, demetalize before going into the scan room, check for wallets, keys, cell phones, any electronics, jewelry, bobby pins or ID badges, clear everything. So we gotta make sure we disinfect high touch surfaces, MRI table, clean linens and pillowcase, disinfect coils and paddings, and then we gotta make sure we've screened the patient appropriately, have them change from street clothes into hospital gowns. And then we gotta make sure we provide hearing protection, proper coil, and our emergency squeeze ball for communication. Coil use and how is the patient positioned. We're gonna use, for the hip, we're gonna use the phased array abdomen or pelvis torso coil. Positioning would be supine, feet first. And then landmark for the hip is the hip joint. Where is landmark? Describe the angulation and coverage for axial. So for the axial sequence, we're gonna plan the slices on the coronal plane. We're gonna angle parallel to the left and right femoral head. And then coverage would be from anterior superior iliac spine up to the lesser trochanter. For the coronal sequence planning, we're gonna do bilateral, which bilateral means both sides. So we're gonna plan the slices on the axial plane. We're gonna angle parallel to the left and right femoral head. And then cover from ischial tuberosity up to the line of the pubic symphysis. And then sagittal sequence, we're gonna do the affected side, either left or right. We're gonna plan the slices on the coronal plane. We're gonna angle parallel to the femur. And then coverage from the hip joint, outer cortex of the greater trochanter up to the inner portion of the acetabulum.